Thanks everybody for being here. Really excited about this talk today with the Integrative Psychiatry Institute's co-founders, Will Vandeveer and Keith Kurlander. I know there's a lot of excitement and a lot of questions that come up around training for psychedelic therapy. So we thought we'd have this session to really dive in to the offering that IPI has. And it's one of the only training programs that we're supporting the promotion of at Psychedelic Support, because we know it's a really high quality program that's going to meet a lot of the standards necessary to really implement this in clinical practice. So we're excited to learn more. I'm going to go ahead and hand it over to Keith and Will. And we have some questions prepared, but if anybody has questions along the way, there is a QA box in the bottom of your dashboard. So that's the best place to put them. We also have the chat activated. You're welcome to say hello to the other participants here and say where you're calling in from. And if there's any discussion that comes up there, I'll try to drop in links as well. All right.
Great. Thank you. Should I get started, Will?
Sure. Sounds good, Keith. Thanks,
Okay.
Ellie.
Well, hi, everybody. We're excited to be here and connect with all of you. And it's great to see where you're from. So that would be great to just throw where you're from in the chat. Somebody from Denver. In our parts, we're in Colorado, in the Boulder area. I think a good starting place is, I'm just going to go over a little bit of the sort of training landscape broadly for a few minutes, to just start there and kind of explain the training landscape and how it and what it looks like right now, and then how IPI fits into that training landscape. So I would say for the last few years is when most of the trainings available at this point have been popping up. There's been a few prior to that were around. And the trainings are a wide range of different types of trainings. There are trainings for people who are not professional counselors or medical providers that work with mental health. And those trainings tend to look at harm reduction. And generally speaking, the trainings are small trainings to get people just really understanding the harm reduction model. And there are some trainings that might be more shamanic trainings that are longer from that model, from the non-counseling model. And then there's where we're placed, which is in the professional and counseling space. And so they're therapy trainings, and there's a handful of them. And then they range in comprehensiveness from anything from 10 to 20-hour trainings, and there are a select few that are essentially fully comprehensive year-long trainings, and that's where we've come in. So we took the view that we really wanted to offer a training that is essentially helping people get competent in a new modality of psychotherapy, or I could just say therapy. And so we felt that a year was a great starting point. Our training's a little less than a year. And it's probably the most extensive training at this point. It's about 250 hours over the course of a year. It's very comprehensive in that we cover the three main medicines that sort of right in this moment people have their eyes on. And those medicines are ketamine, and ketamine-assisted therapy is available now to get involved with. And then MDMA-assisted therapy, which we hope to see as early as a little over a year from now, as it's possible if things get approved. And then psilocybin-assisted therapy, which could be as soon as 2026. So we cover those three medicines in detail. And we've really taken an approach at sort of really taking a deep dive into what is psychedelic therapy, what is the modality, what does it consist of? And we have a lot of different learning formats over the course of a year to do that. And then our training is unique in that both it's the most comprehensive, I would say, in terms of hours and how deep we go into all the medicines. And then we're also unique in that we have a live ketamine-assisted therapy experiential weekend as part of our training. And we also now have, starting in our next cohort, we'll have a psilocybin therapy practicum in Oregon using the Oregon Psilocybin Services Act. So in that way, it's also unique that we've been able to really get comprehensive in terms of live experiential training. And then the last thing I'll say, and then I'm going to pass it off to Will for a little while, is that our training is really focused on the therapy modality. So we're really, we have, to get accepted to our program, you do have to have counseling credentials, and there's a list of what that is, or a medical provider that has worked extensively in mental health care. So I'm going to pause there, and we're going to take a lot of questions in this. We're not going to talk forever. We want to do a lot of questions and answers. Just, we know a lot about the space. It doesn't have to all be about our training. But I'll pass it up to Will. Will's really oversees a lot of our training with the course director that he works with closely. So I'll pass it off to you, Will.
Thanks, Keith. It's a good intro. So yeah, I'll just add a little bit of flavor to what Keith is describing. First, a little bit of context. Our institute's been around for, what is it, Keith, 5 years now? And we both Keith is a therapist, I'm a psychiatrist, and I came to psychedelic therapy by virtue of getting involved in a phase 2 MAPS PTSD trial about 10 years ago, and got to have the rare opportunity to provide MDMA-assisted therapy in a clinical trial. And pretty quickly, I saw people who had many decades of PTSD symptoms get well in a matter of a 5-month protocol and stay well in long-term follow-up studies. So for me as a psychiatrist, I always was a therapist as a psychiatrist, but it became an imperative to help with this bottleneck of training. So Keith and I started offering this program about, was it 1.5 years ago or 2 years ago, Keith?
2 years ago. 2
years ago. So we're now in our 4th round of offering the training, and we're going into our 5th cohort, is the one that Keith was mentioning that starts at the end of July. So we're really pleased with the quality of the program and how people feel about it when they come out of it, how they rate it, and the kind of comments they make about the program. As Keith mentioned, there are these 2 live in-person opportunities with to where you can facilitate someone on ketamine, and if you qualify medically, you can have a ketamine experience. And then with the psilocybin, being able to facilitate someone on psilocybin in Oregon, and also have a personal psilocybin experience in Oregon. Right now, it doesn't look like, right now there's no way for a therapist in training to get to undergo an MDMA training experience. With MAPS, when they were, now with enrollment complete for the phase 3 trial, they're not training new therapists as far as I know. Allie might have a different understanding of that, but hopefully one day we'll be able to have an opportunity to train people by giving them an MDMA assisted therapy session. But right now it's limited to psilocybin and ketamine. I'm not sure I don't think there are other trainings that are doing in-person experiences with multiple medicines. Here's a question in the chat from Clarissa. Can RNs with 3+ years of mental health experience apply to the program? Yes. And so then the question is going to be, how much time do you have, or how many hours do you have providing mental health care? So we can go into that, but thanks for the question. And there is a Q&A function. So if you want to put your questions in the Q&A, we're going to have about 30 minutes of Q&A here. So I don't want anybody to be concerned that their question's not going to get answered. We should have time for plenty of questions. What else? So the training is about 90% online, and it's about of all of the hours of the, Keith said 250 hours, 80% of it is presented live. So live lectures, live experiential learning sessions online. There is about a 20% asynchronous learning component. And we should probably also mention what's happening with MAPS and training, Keith. I think we should go into that.
Yeah, I could take that.
Okay, great.
There was a question in the chat, one point of clarification, which is that RNs are not eligible for a program, PNPs are eligible for a program. Just a point of clarification. Registered nurses are not eligible because they are not in a counseling relationship in the scope of practice, whereas PNPs could be. And we actually now are following rules around this mandated through not just ourselves, but also through Oregon, because we're an Oregon approved training program. So I'll go into MDMA for a moment. Somebody asked the question, how is your program different from MAPS and from CIAS? Our program's quite different from MAPS. MAPS has had to really restructure their program, which is now an educational program only, based on the approval process they're going to have to go through when they submit their new drug application to the FDA. So what that means is that our program is very different. MAPS's program was always a lot smaller than our program and focused entirely on MDMA, and their program has changed a lot. Now it's even smaller and they have a certain amount of educational content. Some of that educational content will be delivered in our program. And they also plan to essentially have a pathway to have all of their educational content accessible, but there'll be a pathway for our students to get to that content. So it's very different. I would say it's much more comprehensive. And outside of the MDMA stuff that MAPS is doing within our program, we're not even going forward our own material with MDMA at all. MAPS does it all for us. We are focused on, doing a therapy training for, which essentially outside of that material is ketamine and psilocybin, and going really deep into that. I am not deeply familiar with the CIS curriculum, but from the surface, I could say I think we go much deeper into these three specific medicines, particularly ketamine and psilocybin. And then we also have the access as part of our program to come to live training weekends with these medicines. So there's a number of ways I think it's pretty different than CIS's program. I wonder if it's time to just start diving into questions. We have a lot of them, or should we say a little bit more about our program? Why don't we just go a little bit into the structure of our program?
Let me just answer this question from Brandy in the chat. Do you think PMHNPs and MDs will be required to have a training like this? This training that we're talking about today is a psychotherapy training. So this is for people who want to provide psychedelic therapy. I think that the medical practitioners who are involved with MDMA, psilocybin, are mostly going to be involved in prescribing the medicines under the REMS that is expected. You mentioned the REMS for ketamine. MAPS is expecting a REMS for MDMA. And so there probably will be a training requirement for the medical providers, but that's not what this is. This is a 250+ hour psychotherapy training, if that makes sense. Mm-hmm. So we think that the medical aspect of training for working with these medications would be a lot less than what this training is. This is a year-long intensive psychotherapy training.
Yeah, I think it's fair to say that, if you're wanting to make sure you're as prepared as you could be for whatever's coming, we've we've really tried to cover everything possible. For instance, when Oregon came about, we were pretty close, and then we got approved, and then we were able to do something for the people that were in past cohorts to get them trained up in a way. So our training is really, we've always had our eye on the possible scenarios that are coming down the line and really trying to address those, because people are pretty excited and want to get trained now. Obviously, it's an incredible moment, and with medicines, I mean, with ketamine here and medicines now potentially like right around the corner, it's a great time to get trained. So yeah, and we'll hear more training requirements hopefully in the next year about the REMS and things like that. But likely the REMS will be not that much in terms of training requirements from the conversations we're having. REMS don't tend to have extensive training requirements, like hundreds of hours. Those could, who knows what that'll be, but it could be a 10-hour module or a 15-hour module, just online recordings. We don't know. But those tend to not be extremely extensive. So we'll see what's coming. I think it would be good to, before we go deep down all these, there's great questions in here, let's just kind of give a brushstroke of our program, how we learn in our program, and things that we've learned over time about what really works to learn about this material. And then I think we could just go Q&A for the rest of it. Does that sound good, Will?
Great.
Do you want to do the brushstroke of the different structural components of our program?
Why don't you go ahead, take it away? Go ahead.
Okay, sure. So our program starts when you register for our program. You immediately start learning, even though our cohorts start twice a year. So we have a 6-month enrollment window in our cohorts because they start twice a year. So we want to get people having prerequisite material so that when they come to the program, if you're not that involved in this space or you haven't learned before, you're going to have about 20 hours of learning under your belt by the time you get to the program. And it's all very foundational material, some foundational research stuff, some basics of the modality, the therapy modality and things. And then the program kicks off with an online live event. It's generally like 2.5 days. It's a really cool time online. Like we have some great speakers. We're kind of really fortunate and blessed. We are very connected in the space. We have some of the great speakers in the space. And so we kick off with really learning some of the bigger foundational topics from the people who have sort of created those foundations. And we do some small group work and breakout work so that you get to know each other and really create safety and a strong bond in that first weekend before we go into our weekly learning environment. And then in our weekly learning environment, we have a whole number of different ways that we learn to accommodate different learning styles, but also to engage you differently. So we have a whole asynchronous learning throughout the whole program. So like if you were at school and you have textbooks and things, but it's a lot more engaging because it's online, so you can do different mediums for that. So alongside learning the whole time, there's asynchronous learning, everything from videos and self-reflection exercises and all kinds of things like that. And then on a weekly basis, depending on the week, we have home groups. This is where we go into a much smaller sort of mini cohort model within the cohort. Our cohorts are large, so you'll get the opportunity to meet a lot of different people. They generally are anywhere from 400 plus people. And so in home groups, you're with 10 to 12 people. And that's where your home group facilitator is really helping you digest the materials. It's sort of a study group and discussion-based environment to connect to each other. And then we have weekly lectures online where you can come live and interact with the faculty and hear some of the academic lectures and things like that. And we also have then a version of our structures called large group seminars, which is a 2-hour experience every other week, where you come, and this is an experiential part of our training where there's some teaching, and then we send you into breakout rooms and you're starting to try things out. And you have to be creative with no medicine. And we've worked hard, and we constantly do, to how do you, do this, right, without medicine in these environments. But the good news is that part of psychedelic therapy is not just a dosing session, right? So there's a lot to do there, and it's fun, and it's also great because it's a time where you'll break out into groups of 3 or groups of 6 and really start to get to meet people. And then we also have almost everyone in our cohorts come for a ketamine-assisted therapy training weekend, which is a really exciting time. It's a few days long, and we're able to give ketamine if you're medically approved based on being a mental health provider. We can do a treatment for provider stress and burnout. And most providers tend to actually demonstrate that. So we're able to do that. So most people do end up doing a dosing session. You also get to be a therapist on that weekend as a sort of educational experience. And those are really lively and exciting. And then we end the whole program at the end with another live event. And then, going forward now, there's also the option for everyone to do a psilocybin week-long practicum in Oregon, which is really exciting. We just got our approval a few days ago, and our first retreats start at the end of July. So we're very excited about that. And it's just such a cool time that at a state level, this is happening, right? We're literally here where our institute can now go at the state level and use psilocybin for training, which is obviously a really different, it's really different element than using ketamine. So that's the overview. We have an incredible team. We're just so fortunate to be among an incredible team. Our team is about 100 strong. There's a lot of people involved making this happen, because we want people to feel really well taken care of. It's so important to us. And, it's important. You're in when I went through my therapy counseling program or any of the postgraduate programs I went through, it's like you want to know you're taken care of and that you feel like people are looking out for you. So we really want to make sure that's happening. So I think it's time to now transition from us just talking to really going deep into these questions. So why don't we go one by one, Will, and just get through them all? Does that sound good?
That sounds great.
Yeah. Okay. So the first question, will it be sufficient to qualify as a psychedelic therapy practitioner as a certified or registered counselor in BC? Well, this opens up sort of a different can of worms, which is, what will qualify you anywhere. And I think the easiest thing to speak to is the United States for us, versus speaking to Canada or Europe. But in the United States, what it looks like is that it will depend on the medicine. So ketamine, right now, if you get involved with ketamine, particularly generic ketamine, ketamine does not have an indication for psychedelic therapy. It's not indicated for psychedelic therapy. So anyone getting involved with ketamine is practicing psychedelic therapy off-label to what the medicine was indicated for from the FDA trials. So that's just one thing to know, but medicine is used off-label often. That's not uncommon. So there are no, like from a therapy perspective with ketamine, there's no governing body that says this is how you have to do it. And from a ketamine perspective, I think the best thing to do is do a very comprehensive training, so that you feel like you understand the landscape, you understand your scope of practice, you've asked the right questions to the people you need to, and that you're well educated enough to get involved the way you want. There's different ways to get involved with ketamine. You can go work for a clinic that's doing it. Some people get connected through different services where their clients get the medicine through telemedicine, they bring it to your office. So this is where education comes in, and having a good education about how you want to get involved with ketamine. MDMA, we don't know, but it sure looks like what'll happen is there'll be some requirement of some kind of level of training to get involved. And, that's what will probably happen. In terms of how much training, that remains to be seen. But that, that again is what we are trying to make our best guess assumptions based on, we have very insider information here. So we work hard at really developing our programs in a way that align. Psilocybin's different. If psilocybin gets through phase 3 trials, 2026, 2027, if that happened, it could even be less training requirements than MDMA, and it very well might be. But I think there's the other question more of, what level of training do you feel like you need in order to actually do this competently? And I would just say that this is a therapy modality. And I think it should just be looked at that way. So if you were to go practice in a very robust therapy modality, that's what this is. So I think it requires a good amount of training so you feel confident. We already answered the MAP CIS. Well, people in our cohorts have the opportunity to engage in the Oregon psilocybin experiential training we have. If you're asking about past cohorts or current, yes, you will be receiving an email next week. Here, how are the graduates from previous cohorts of IPI able to participate in the psilocybin experiential? Same thing. You will be finding out shortly, but you will be invited to do that if that's what you want to do, and we would love to have you. You want to take some questions in the chat box, Will? Do you see any?
Yeah, great. So there's one from Nima in Australia. We've had a number of international students who have done exactly what you described there, to take the online component and then just visit us for the in-person component only to finish it off. So it's absolutely doable. We've had a number of people from Europe and Australia, New Zealand, South America. So absolutely, a lot of Canadians.
About 10% of our cohort is international, from all over the world. People are definitely getting very interested from very remote places at this point from us, which is exciting. Let's see what's next in here. If not, we could go to the other ones that we have prior to the call, Will.
Great.
If you're needing financial aid, we offer scholarships, but we run out of them within the first couple of weeks. We offer quite a bit of scholarships, but we run out of them within the first couple of weeks of program enrollment. So if you absolutely need a scholarship, then the time to apply is, reach out to us, let our people know that that's the only way you're going to be able to do this, and they will let you know when the next round of scholarship opens up. Okay.
Do you want to talk about certification nationwide? What's going on?
I think that so there's different bodies, associations that are being created to attempt to create a certification that would be recognized nationally. And what that means in the therapy space, if that were to happen, this isn't new in the therapy space. It's happened before, but it's very rare, but it has happened. So for instance, the Art Therapy Association was able to create a sort of national level certification that is somewhat recognized as something across states. So there are associations sort of trying to attempt to create something that will be recognized. I'm not sure that, I wouldn't worry too much about that personally. I'm not, because at the end of the day, every state is an individual state, and what they're probably going to do is turn toward looking at the FDA rules. And I'm not personally too worried about that. And that tends, when associations in psychotherapy create these things, it tends to take a long time for sort of a cultural buy-in to the association having a lot of weight. So that's where that's at, but people are right now trying to do that. And that would be great if that happens. Okay, we might just go to our
There's a
other questions.
question. There's a question in the chat, Keith, from Tracy saying, if we attend the training, can we call ourselves a psychedelic-assisted therapist? And if we're in private practice, how do we sync up with a psychiatrist who prescribes? And would those clients only be able to do sublingual ketamine as opposed to IM, since a therapist can't administer ketamine?
Well, I'll take the certification part.
Okay.
We have an internal certification, assuming you pass everything. And it's it's a certified psychedelic-assisted therapy practitioner, something like that. Whether or not you can use that language in your state, in your jurisdiction, that is something you have to find out, because states have all kinds of rules about words when it comes to therapy. So that would be something you have to find out if you're allowed to use that language in your jurisdiction. But we're okay with you using the language. That's why we give you the title, because it means something to us. And we're one of the few people that took the stance of actually giving a certification out, because we believe that we created a robust enough training that we can stand behind it. But you do have to look into whether you can actually use the language of that, what's in that certification title. Were there other parts of that you wanted to answer?
Yeah, and then just to follow up on the other part of Tracy's question was, how do you get connected with a psychiatrist, or does that mean sublingual only? So I guess to keep it brief, there are ways that you can get connected to a prescriber once you have a training like ours, or other trainings. A lot of these relationships happen between an online prescriber who would see the client remotely, and then if they qualify, they would be prescribed a set of sublingual tablets. And then the client would bring the tablets to your office, and you would do sublingual session. There are a number of online groups that provide that service. And then, yes, that would mean that you would not give an IM shot, because it would be outside the scope of practice for a therapist to give a intramuscular shot. But there's a large number of psychedelic therapists doing sublingual ketamine dosing this particular way.
Yeah, and it would be outside the scope of practice for a therapist to touch the dose. The client would be self-responsible to administer the dose. They're not involved at all with anything about that.
Right.
And that would be between the client and the telemedicine provider or in-person provider that they got the dose from, about being told how to do that safely. There's a piece in here about transcendental experiences, profound transcendental experiences. Yeah, we do definitely address that in depth. One of the powerful aspects of psychedelic therapy is transcendental experiences that need integration and exploration. So we have a lot of curriculum discussing those types of experiences and different frameworks on those experiences, and how to deal with very challenging experiences of that nature and what to do about that. Let's see here.
Keith, Nadine has a question about prerequisites. How do I know if I'm academically eligible? Is there a link for financial aid that's different from the scholarship link?
If you're needing a scholarship, you can apply to our program, and right now we wouldn't be able to take you just because our scholarship window is closed. And then they will put you on a wait list for a scholarship. But in terms of if you have the credentials, there is a list in here that Ali dropped in here It's basically licensed counselors and psychologists and those types of licenses, so licensed mental health counselors, that range, and physicians who, nurse practitioners, physicians assistants who have a fair degree, a pretty high degree of background in mental health care.
I'll take this one from Joel.
Yeah.
Can you talk about therapeutic techniques, the amount of sessions, et cetera? Does it vary depending on condition of the patient or the medicine used? Yes, good questions. I think that Allie has some really good introductory material on her website, Psychedelic Support, to get you familiar with this, but I'll just summarize briefly that the therapeutic techniques that are used in psychedelic therapy are different, and they're also there's an opportunity to incorporate the tools that you already have as a therapist. So you will use some of the tools that you already have from your graduate education, but you will do things that are very different from therapy given in ordinary consciousness. And I'll just give you an example. In the MDMA protocol, when I was trained in MDMA therapy, I learned about a thing called the inner healing intelligence, or the inner healer. And this is it's a concept that is hard to work with in ordinary consciousness, because when people have severe PTSD, they're usually not in touch with any kind of sense of inner wisdom or inner divinity. But with the effect of the MDMA on board, it's a really common experience for people in MDMA therapy to deeply connect with their inner wisdom, their inner knowing. And it becomes a lot more feasible for the model that the client can heal themselves given the right set and setting and the right support from the therapist, rather than a more, I would say, more disempowered or more passive role that can happen in talk therapy, where the therapist is the source of the wisdom or the interpretations or the wise commentary that helps the client get to the bottom of their problems. So I could talk for hours, and we teach people in great detail about the differences between the techniques, but that's just one example. The amount of sessions varies by medicine in terms of the FDA protocols that are being studied. The psilocybin protocols range from 1 session to 3 sessions. I haven't seen one that is more than 3 sessions. MDMA assisted therapy for PTSD is mostly studied in a 3-session model, where the MDMA session happens once a month, and there's a lot of preparation and integration sessions that are scheduled in between those MDMA sessions. And then the condition of the patient, there will be, hopefully, we're all hoping that when we have access to MDMA and psilocybin, that there will be flexibility to be able to give people with more severe conditions additional sessions than what's been studied in these FDA protocols. So a little bit of a maybe longer answer to your short question, but it's a great question. Are these sessions covered by insurance, or would this be billed as a general counseling session? That's a great question. So the people at MAPS, and also people from a company in the UK that's developing psilocybin called Compass, MAPS and Compass worked together to bring forward the approval of a new CPT code. CPT codes are used for reimbursement from insurance companies that will apply to psychedelic therapy. And the details on that CPT code are coming out in July. So we don't have a lot of details right now, but I've been told that that code will be flexible and be able to be used for various medicines for psychedelic therapy. So that's in other words, people are in the background working hard on getting these infrastructures set up so that at FDA approval, what often happens with the medicine, if it goes through that whole arduous process of getting approval, typically insurance carriers will quickly get on board with covering the cost of these sessions. But as you can imagine, these protocols are very intensive on the number of hours of psychotherapy, and psychotherapy is expensive to cover. So there's also a lot of work being done around how do we make this more accessible, how we make it more affordable. Is there any way that we could reduce the number of therapist hours for these protocols? The MAPS protocol is a 2-therapist model. So you have many hours of therapy, but then you also have to pay, you have 2 therapists in the room who need to make a living to be able to do that. So there's a lot happening to try to make it more affordable after, we can't guarantee that there'll be FDA approval, but we hope, and the data looks very promising for that.
There's a question in here about people addiction who might be utilizing these services, and does our program go into that type of client presentation? Our program covers all. Yes, our program goes through all different types of scenarios and presentations, and something was mentioned here about with that presentation, trauma. We do a lot of exploration around trauma because psychedelic therapy, trauma is often emerges that clients weren't aware of. That's very common in psychedelic therapy. So you have to have a pretty good understanding of trauma and working with that. Psychedelic therapy is obviously very different than ordinary conscious therapy because it will amplify things in your system that sometimes will come out and overwhelm you, right? So you have to really understand how to work with that and help someone integrate that material, because you can be speeding up therapy. I mean, that's real, right? Psychedelic therapy can greatly speed up the process of therapy. It doesn't mean that you don't have work anymore to do in therapy, but sometimes with like PTSD and things and trauma, people have tried to get through things and they're really stuck, demonstrating really pretty significant symptoms for years, for decades, and within a month of psychedelic therapy or 2 months, they've completely knocked it out of the park. So it's a very strong approach, and that's where the training comes in. So yeah, we do cover that. I have on my other sheet here. This was an interesting question that I have on another sheet here, which is that who's involved with IPI given what happened with synthesis? So I just want to speak to that quickly here. If you're tracking the space really closely, you've seen in the last 9 months a number of different organizations either go bankrupt, kind of close their doors. And Synthesis was one of those, which was a training institute. IPI is a private organization. Will and I are the founders and the owners. We don't have investors and all of that. So we're very stable because our training is very different than the organizations that have had some trouble here. Because we started as a continuing education institute, and we knew from the beginning that it's very important if we want to have an organization that's going to influence change, which is why we created the organization, which is really, to deal with the mental health care crisis right now on the planet. We needed to diversify the organization so it can go through different waves. There's always waves in the world. And so our organization is really a continuing education organization and has lots of programs. So we have lots of offerings and things. So our organization's in a very different position than other people. It's very stable. And we have the resources to be able to produce a really great training because of that. So that might answer some of the questions that people were asking about there. Let's see what else is in here. More questions. Okay, the Q&A has a lot of questions in here. Let's get into the Q&A box. Have you been in here, Will?
Yeah, I'm in both places.
Okay.
Here's a question from Keith, maybe you can answer this one from Nadine. What if I am short of credits, but have plenty of work and work study experience within the psychology field? I'm short 18 credits for a double bachelor in forensic and correctional psychology. And I worked with, I don't know what BOP, Board of Prisons, maybe. I don't know what that means, with mentally ill inmates.
Yeah, right now our program is specifically designed for graduate level counseling / medical education. And that is because within the scope of practice of where this is headed, that's where the scope of practice will likely be. And we started as a continuing education institute. So we wouldn't be the right program for that situation. But I think you could probably find a program out there. But we're really focused on people that are coming into our program with a background in counseling psychology, because we're essentially an advanced psychotherapy training. So coming into the program, you have to have a counseling background, or you're gonna really struggle in our program, because it's essentially an advanced counseling program. Right. Let's see what else is in here. See anything else? Well, that's new here.
How do I become a legal prescriber?
Oh yeah, I saw that one.
Okay.
There was a question about a therapist, actually. Let's start with that. There was a question in there that said, how do I prescribe, or how do I work with the medicines that aren't legal yet as a therapist? That was one question. Well, you can't legally, so we don't recommend it. We don't recommend working with medicines underground as a therapist, because there's a lot of ethic boards that will come after you if they find out. So we don't recommend it. And we're not far away here from, if we're just patient for a year, even, or 2 years, like this is outside of even ketamine right now. Like we don't really need to have to do that with how close we are now. So that's how I would answer that, which is, as a therapist, I don't think you really need to get into working illegally. How do I become a legal prescriber? If you are a medical prescriber, right now, the thing that you could potentially get involved with would be ketamine. And we do have a ketamine medical provider training that if you want to get involved with ketamine as a medical prescriber, that would be the training for you to understand how to do that. And then likely what will have to happen is we'll probably have to have an MDMA prescriber course, the psilocybin prescriber course, once the REMS are established, to how to do that safely too.
So let's go to Lori's question, Keith. Thanks for being patient, Lori. I know you've been waiting for a while for this to get covered. Is there if this is a psychotherapy training, how do you meet both the needs of newer clinicians as well as folks who've been practicing for 20 years? I've heard concerns from colleagues that other trainings sometimes are too basic and not fully giving us the more advanced information we're needing, or dragging out the program because too much introductory work.
I would say our program, we really try to make it well-rounded. I mean, we are assuming that you're coming to our program with basic training. We're not assuming that you're coming to our program with advanced training in psychedelic therapy. We're not making that assumption. So if somebody's done a ton of psychedelic therapy training elsewhere and they don't want to hear any more about it, that wouldn't be our program. We're actually starting with, you don't know much about psychedelic therapy, the modality, and really how to do it. So that goes from basic to intermediate to advanced throughout our program. But we are assuming in our program that you're coming with fundamental counseling skills. So, we're not doing, counseling skills 101, like empathic listening and, reflective listening and paraphrasing and just doing that back and forth for, a month. Like we don't do that kind of stuff.
And then here's a related question from Fareed. Is the paradigm you use in your training more similar to psychedelic therapy or psycholytic therapy? that is to say, and for people who don't know those terms, a few high dose versus several low to medium dose during the course of psychotherapy. I'll answer that one. So we discuss both methods, Fareed, and this is mostly pertaining, I would say, to the work with ketamine. So sublingual ketamine is oftentimes a good fit for what we call psycholytic therapy. So this is when the person is who's on ketamine is sort of more able to interact, more able to talk, more able to share what their inner experience is, versus higher dose or more rapid acting routes of administration like IM, intramuscular or intravenous, where at certain doses, people tend to be more laid out with ketamine and less able to participate in therapy for a period of time. I think that the categories of psychedelic and psycholytic are worth knowing about, but it's really more of a continuum, I would say, from having a lot of experience with providing ketamine therapy. And it's also oftentimes quite difficult a priori to predict who's going to go into more of a deeper internal state and be behind the eye shades and listening to music for 20 to 30 minutes on ketamine versus being in a lighter psychedelic state where there's more conversation happening. And so there's benefits and drawbacks to each, and there's applications of each. So we tend to talk about both in the training. Someone had a question, Keith, about CE and CME. You want to take that?
So our training does not provide CME, which is continuing medical education credits. Some trainings have gotten CME. Our CME providers have mostly said, look, it's we're a little hesitant there, and we've just not pushed it because most of the medical providers that take our training, they're not taking our training for CME. We do have CE, so that's more for therapy. So our training going forward, it will count for up to about 30 credit hours of CE. Let's see what else. Let's get some more questions in here.
Let's see. What else?
Medical students, thanks, Allie. So that's a good question, and it also would pertain to graduate counseling students. We cannot accept students into our program. We can't even do that legally anymore. But we can accept like a graduate counseling student once they've graduated, pre-licensed, but they have to be working in the field. So yeah, we couldn't take a medical student if they don't have other training from elsewhere, like a graduate degree in counseling. So yeah, we don't take students in our program that are not practicing in the field yet. How does liability insurance work? Well, that's a good question, and I would say it's a little gray, but because mostly what happens is certain liability insurance companies, when you call them, the first thing is you have to call your liability insurance company. So you want to call your professional liability insurance company and say, I'm going to be doing ketamine assisted therapy, which is what you would be doing now, if you're going to be doing it. And you would tell them that, and you would ask them, is that covered? So you're going to get sort of one of three answers. They may say, yes, that's fine, as long as you're within your scope of practice, is what they'll tell you. They may say, no, we don't cover that. And they may say, it's just up to you. We don't know. It's up to you to determine if you're in your scope of practice or not, and get kind of a gray answer. But yeah, you want to always make sure you have talked to your liability insurance carrier before doing this.
I want to clarify. So Jessica's asking about something on the website that says if you choose not to do the experiential ketamine experience, you cannot be fully certified. So I'm glad this came up. So there is no requirement to undergo a ketamine experience. We want to be absolutely explicit about that. Obviously, it would be unethical to require someone to have an experience that they might not even medically qualify for. So, but you do need to come to the weekend so that we can show you in person and give you in-person instruction about providing a ketamine-assisted therapy. So the requirement is to come to a live event. It's not to receive ketamine. Here's a question about the APA, Keith, and whether the American Psychological Association accepts the CE.
Ours, because ours is APA, it's through, so right now it's through the Spiritual Competency Academy, which is an APA. Basically, they have an APA approval around being a continuing education provider, and then we're a joint provider with them. So it is APA CE that we're giving out.
Great. And then someone had a question about, oh, how do I use this if I'm not in a state where it's legal? So this is great question. So obviously most states, there's no state measure, although there are a lot of states that are trying to get those done right now. If you're in a state where there's no state measure to allow you to provide psychedelic therapy, obviously you can use ketamine, which is on Schedule 3 with the DEA. So people are doing ketamine-assisted therapy in all 50 states. There's no problem there. And then it's expected that the FDA will review MDMA-assisted therapy next summer, so a year from now. And so a lot of people are choosing to get trained ahead of that so that they're prepared for that. And then the schedule, as Keith mentioned at the beginning of the call, for psilocybin-assisted therapy, the expectation is that will get reviewed by FDA sometime in late 2025. So it would really apply mostly to ketamine-assisted therapy at this point in time if you're in one of those states.
Right. And we only have a few more minutes. Is there any questions in here we can answer? Well,
is Oregon a state that psychedelics is legal? So briefly, Oregon passed a measure that made psilocybin services, and that's a very specific language they used in Oregon, available as of the beginning of this year. We have a service center that was approved as of a couple weeks ago. So it's important to note that in Oregon, psilocybin services they're deliberately placed by the state of Oregon outside the purview of the practice of medicine or the practice of psychotherapy. So if you're an Oregon resident, you can currently get a certification in Oregon that will allow you, if you have the right training, to provide psilocybin services, but you would not be functioning as a therapist in that setting, if that makes sense.
Yeah, it's called a facilitator, and it's essentially a personal development service. And there's a lot of rules to keep yourself out of the scope of practice of mental health care. So yeah, it's a very interesting thing they did there. Great. Well, it's 4:59. Allie, any last things to say?
Now my video won't start, but
Oh, okay.
I'll let you guys wrap it up. But this was really informative, and I've learned quite a bit. And I just dropped in the chat a few links and let people know if we didn't answer your questions sufficiently, just to send us an email. And we're happy to communicate by email and get the information to you.
Perfect. Well, thanks a lot, Allie, for this opportunity. And it's been a really fun conversation with y'all. So thanks for coming.
Thank you, everybody.
Yeah, thanks for being here, everyone. We appreciate you showing up, and this is going to be a great program that I know is going to be a great cohort for July.